What's up, everybody? Zach Shelley here with Management Unfiltered, and
I'm Kirk Teachout, and this is another great episode that we are getting into. But I'm going to tell you right now, we're coming in hot, and I'm going to throw this at you. You are the problem.
And who's the problem, Kirk? Who's the problem? Are you talking about me?
No, I'm not talking about you. I'm talking about the economy. I'm talking about people. I'm talking about doctors and hygienists. So today we're going to be talking about how to attract, and this is probably going to be a two-parter because we have so much to talk about and not a ton of time, but we want to get this in and leave you on a cliffhanger. So how do we attract good hygienists, A players, really great providers in our practice? I know there's a battle going on between hygienists and doctors. And like I said, you're the problem. And when I'm talking to you, I hope there are hygienists listening because it's not just the doctor's problem. Okay. The hygienists are also the problem. I see it on both sides objectively. I see it from the hygienist side. I get it because there are bad actors out there that just are trying to make a great bottom line and not care about them as a provider. But on the flip side, the hygienists also have bad actors that are out there thinking, they're coming out of hygiene and they're just like, you don't deserve anything. You have no experience. Okay. And the worst time to negotiate your pay, I heard this the other day, is before you start working. You have no precedence to deserve anything for the most part. Okay. I would say the majority. Okay. There are circumstances where it makes sense, but both sides are at fault here. And we have to come together as a team. Okay. Not staff. You will not hear me say staff ever. Staff is an infection and you need to get that out. Right. But you're a team, right? You're a team. When I worked at Target, I loved how they started flipping that on their head. It's like, hey, we're a team. All right. We're a flow team. We're a grocery team. We're, toys team, whatever it was. We are a team, and you have to come together as a team, as a unit. And so we're going to start with, how do we attract the right hygienist as an office? So I'm going to lob this back over to you now that I'm off my soapbox, Zach.
Oh, thanks. You give me the easy part. How do we attract? Well, I'm gonna be a little bit more controversial too with this, Kirk, because this is Management Unfiltered. Office managers, you're the problem too. You create a lot of unneeded problems. You try to take care of these issues without talking to your owner doc or bringing on this facade of like you're this rock star office manager, which I'm not saying all of you aren't, but you come off in a manner that is very unattractive for a hygienist coming in. I think in your manner, in Doc's manner, and the hygienist, all of y'all need to start coming in with an open mind. We set previous standards and expectations of who we had as a hygienist before they left that we're replacing that person. Like say Sherry gets fired, right? And we're bringing a new person in and we're comparing that to her. It's like, we can't. Or if they were a great hygienist and it's like, well, she used to do this. It's like, no. You're not them. But what are our standards? What are our expectations? And also, what does our practice look like when this hygienist comes in to drop off her resume or come in for an interview? These are big things that I've heard every single time. I walked into your practice and it was beautiful. I knew right there that I was very interested in working for your practice. And then I met your team. And it goes one way or another, right? I met your team and I changed my mind and I never want to come into this practice again. Or I met your team and it was incredible. One way that I come in, and some may see this as being cocky, and that's okay. But Kirk, you'll probably be the same way. I come in extremely confident when I have a hygienist come in and I say, hey, go talk to one of my other hygienists without me. And I can guarantee you're going to hear what you need to hear. And I have not fluffed or done anything to prep them or anything. I say, hey, Amber, can they talk to you real quick? And they're like, oh, who's this? I said, a hygienist looking to apply. Will you just kind of give them the lowdown real quick before I even talk to her? And then bring them back to talk to me. But what that requires is to have a good, tight-knit team. And it starts with leadership down. It starts with the doctor empowering the hygienist because they're licensed providers to do their job and also work alongside them to empower them to make it cohesive. We have created so many problems. I was just talking about this yesterday on a different meeting, and I was like, we've made our bed. It's a very messy bed and a dirty bed. And then we just like to complain about it and be like, woe is me that it's so hard to find all this. But we've not set up a good opportunity to have a hygienist come in and want to live, right? Like we spend so much time together in doing this. Like we should be making it very, very simple, very easy, but also approachable. And I think the biggest thing right there, Kirk, is if you didn't hear anything I said, the only thing you need to hear is have an open mind when these hygienists come in.
You kind of hit the nail on the head, right? If it boils down, the solution and the start of all of this is the ability to set a standard and hold people accountable to that standard, right? But and we've talked about this, but so you have a standard, you hold people to it, but do you hold your patients to the same standard? Because people may have a great work culture, but if they cannot stand the patients that they're seeing, they will also leave, right? And we'll get into retaining. We're not going to get into it right now, but still setting a standard to where, okay, this is the place I want to work because of the environment that's there, right? It's not toxic. You don't have an office manager that's running a power trip all the time. You don't have an owner doc who is running a power trip all the time. It's like, it's my way or the highway, all these things. Like, it's a different mentality. And so if we can open our minds to just see, like, okay, how are we doing this? Should we be doing it this way? And is there a way that maybe we can get better?
We need to be really good active listeners too. Because I can guarantee you every one of these hygienists that come into your office to interview tell you exactly what they hated about their old practice. They might not say it directly, but 90% of the time they will. Say, patient care wasn't the focus. This wasn't the focus. I really struggled with this. Listen to those things. Right then and there, you're going to know whether or not they're a good fit. If they align with your values, like winner, chicken dinner, like that's one of the hardest things. I remember I was snowboarding in New Mexico, and this kid was like, yeah, I just quit my job. And I was like, okay. And we're listening, like just kind of listening on this conversation because it's not with us, it's with someone else. And he's like, I just didn't align with the company's values. And I was like, dude, right there, like you can't fake that. You can't, I mean, you can get through it for some time, but it's like over time, there's going to be a separation because you just can't push that long enough when you don't align with them. So really, really listen to what they're saying, their body language and their experience of what they loved or didn't love and go from there.
So when we hired an associate, she was driving almost an hour one way, right, to our practice. But she said, she had plenty of offers from other offices, but she came to our office because of how it felt when she walked in, right? Of how it felt when she was walking around and the team and the culture and the feel. There's a sense that people get. So now if you have a hygienist who you're trying to attract, is like, yeah, clean yourself up, clean your office up, make sure that things are going well. And sure, it takes time, but there's a way for you to really be attractive, not only for your patients, but also your team, because they're honestly your biggest client, right? You've got to be able to attract them. But I want to go a step back because that's if they're already in the office. Okay. How do we get them to the office? I'm going to start with this because this is an Indeed ad, a Facebook ad like that we run when we're trying to find a new position. And I've got to give credit to our buddy Wes, who's an amazing leadership, person, but he uses this and I've started using it. And I agree with him. This turned the faucet on of my Indeed ads and my Meta ads because trying to get people in is tough right now. Right. So just even getting in front of people is tough, but this is what kind of turned this for us. So here's what the verbiage says. It says, as a hygienist, you play a critical role in the success of any dental team you choose to join. So we're automatically getting on top of things of like, hey, you're valuable and you're going to provide value no matter where you go. Right. But at Covington Family Dental, which is our office, we understand your value and know you are looking for an environment where you can succeed. We offer competitive pay and benefits, a team that focuses on positive work culture, and a place where you can consistently grow both personally and professionally. We are looking for team members who live our core values of positivity, integrity, growth, teamwork, consistency, and compassion. Our full-time team members work 3.5 days per week, and we will provide training to help you feel confident assisting our doctors in all general restorative procedures. Team members will have plenty of opportunities for personal development, including learning new procedures and stepping into leadership roles as the practice continues to grow. Now that hits all of what we just talked about, right? Core values, bolstering them up, right? Not trying to sell our practice to them, but just like, hey, we're going to provide value for you up front. And we know that you're going to provide value. Let's go ahead and marry this, right? And at least talk before we get to that point. So based off of that, how do you guys get people in the door before you even try to convince them that you're the right fit?
I'm big on referrals, and not referrals from just patients, but our inner team went to school with other hygienists. They know people at other practices. And I'm not saying we're going and poaching people from other practices, but if they're not happy and their friends talk, right? Everybody talks. The first thing I do is I talk to my team of 10 hygienists and I say, hey, you know, any hygienist that you'd love working with that's looking for a job? And they say, oh, are we hiring? Well, yeah, we need somebody on this day, and this day. And I'll tell you, I found 80% of my hygienists that way. I haven't even put an Indeed ad out. I just ask for an internal referral. The other thing I do is it's different for us, Kirk, because there's so many hygienists. The ones that aren't working full time, who wants to pick up days permanently? Not just here and there, but does anybody want more hours? Who wants to make more money? I give it the first right of refusal is what I call it, for the schedule. And like, does anybody want to make more money? And if they all say no, then I say, who do you know that's looking for a job as a hygienist? And then if there's no feedback in the first day or so, then I make a post very similar to that, not quite as robust, which that is a very, very good Indeed post, but you need to catch the eye of that hygienist. And the big thing is usually, aside from Indeed, I'll look for our local community of dental Facebook groups. So we have like dental people of Brevard or dental people of your city, and just post in there. And if your practice has a good reputation, you're not going to get, sandblasted and say this office is terrible. So if you don't have a good reputation as a practice, that's the first thing you need to be working on is your presence in the community, getting a better reputation, having good reviews, because hygienists look at that. They look at what the reviews of patients say and say, hey, so-and-so is terrible. And they may actually ask you about that if they come in. And so you need to make sure that your practice is in good standing with the community also, because that's going to be very unattractive for a hygienist wanting to come work and be associated with a practice like that.
But to your point, like internal referrals are always best if you can get that. So I always start there, obviously, because your team knows your standard. They know what you're looking for. They know who they would want to work with and who they don't want to work with, right? So they are the best referral system versus just kind of scattering, sending a net out there and trying to grab fish. But if you can, that's the best. But then, like you were saying, like just go on to the next step. Then it's trying to figure out people in these groups, right? And then sending out those ads, that's a last ditch effort for me as well. Typically, another thing I do, this is a cheap way to do it as well, is use that same type of post on Facebook with a great photo of the team, and then you boost it. But at the end, it's tag your favorite, like for anybody who is wanting to change their position or is looking for a great environment, because in those tags, because your ad's going out to every single person because you can't discriminate, right? So it's just like, okay, how can we get more bang for our buck? Well, with those tags, you're getting even more reach for the same amount of money, right? And you're going to get people that you wouldn't have had otherwise. Well, okay, guys, this is part one. How do we attract? We've gone over how we attract our A-team hygienists. But in the next episode, hopefully, wherever we put this, we're going to talk about how do we retain? How do we keep these people in our practice versus a constant churn of team members? So make sure you like, subscribe, share, hit the YouTubes. give us a 5-star rating as well if you can, so that way we can continue doing this. Give us your feedback in Zach's group. Zach, do you have anything else?
Nope. Just what Kirk said. Like, subscribe, go to MySpace, Facebook, Instagram. If you don't have MySpace anymore, it's okay. And do all the things. Share it, get other people to listen to it, show it to your doctors if you're an office manager, and docs, show your office managers. Show there's a ton to learn from, and we'd love to continue to grow with you guys. Until next time.
Come on, give me some.